evening, everyone. My name is Simiran Choudhary, and on behalf of Voice of Healthcare, I warmly welcome you all to this panel discussion, Embracing Pink Beyond Ribbon, Breast Cancer Awareness, organized by Voice of Healthcare and supported by Pfizer. As we all have come together during this Breast Cancer Awareness Month, this event goes beyond just wearing pink. It is about deepening our understanding of breast cancer and empowering ourselves and our communities with knowledge. Today, we have the opportunity to explore the latest advancements in breast cancer research, treatment, and the importance of early detection, while also addressing the emotional, social, and the physical impact of the disease on patients and survivors. And today, for this panel discussion, we are honored to have a panel of esteemed experts who will shed light on the key facets of breast cancer care and awareness. Together, we not only aim to inform but to inspire change in how we approach this journey, both individually and collectively. So, without any delay, I would like to welcome all my panelists and I would like to introduce them. Starting with Dr. Praveena Vonna, medical oncologist and hemato oncologist at Mahatma Gandhi Cancer Hospital and Research Institute with Visakhapatnam. Welcome to our show, ma'am.
Thank you. Thank you.
Thank you so much, ma'am. Dr. Samir Khatri, Director of I'm so sorry. I think there's some error in this because this was going a long way back. Uh,
Yeah. So
I'm so
I
sorry
am
for
Dr.
that, Dr.
Yeah, I
Samir.
am Dr.
I'll just
Samir
introduce.
Khatri. So I am Dr. Samir Khatri. So I have the Senior Director Medical Oncology in Max Hospital, Parparganj.
Yes, thank you so much, sir. Thank you and welcome to this show.
Thank you.
Dr. Mohit Saxena, Consultant and HOD Medical Oncology at Manipal Hospital, Gurugram. Welcome to our show, Dr. Mohit.
Thank you.
Thank you so much, sir, for joining in. And Dr. Dutta Choudhary is also supposed to join, but because of some emergency, maybe he won't be able to join or may join in between. So we'll be starting with a panel discussion. Starting with the general awareness and early detection, I would like to know from Dr. Sameer. So, how important is early detection of breast cancer, and what are the most effective screening methods? Why I'm starting with directly to early detection is now because nowadays public is more aware of all the diseases because of the Google, social media, Instagram, or let's give a credit to the celebrities who are becoming more and more vocal about the disease and creating awareness about it. So I'll be starting with the early detection.
Yeah. Hi. So Simran, as you rightly pointed out, the importance of early detection yourself. So early detection is a very, very crucial aspect as far as the treatment of breast cancer and journey of the patient is concerned. I will say that early detection is for the patient's own protection. It not only improves the chances of a successful treatment, it also increases the survival. As we all know, if the breast cancer it is diagnosed before it has spread, the survival rates are much higher. The
Yes.
stage 1 and 2 survival rates are markedly better as compared to when the patient is diagnosed with an advanced stage like stage 4. And we all know early stage is curable and advanced stage 4 is not curable. For early detection, we often mean that less aggressive treatment is required. So suppose a small disease is there, like 1 centimeter or less than 1 centimeter, detected in a routine mammography. So we can do a breast conservation surgery in such kind of patient instead of doing a total mastectomy. So it improves the quality of life of the patient also. And as far as the methods of early detection is concerned, the screening is the most important aspect. And for screening, we have mammography. The most important, a yearly mammography is recommended for all those patients who are, all those women who are more than 40 years of age. But those women who have a high risk, like they have a family history, strong family history of breast cancer, or they have certain genes positive, like BRCA1 and 2 are positive, then recommendations are a bit earlier. And a regular examination, that is called clinical breast examination, is also recommended. And often we recommend a self breast examination in such kind of patient.
Sir, as we just talked about the early detection and how important is early detection in terms of breast cancer or any other kind of disease, but I think a follow-up question on that, because we know there's a lot of misconceptions, myths around, or let's say a hesitancy or a fear about, okay, uh, every person thinks that I can't get this, right? And we make ourselves, distinguished from the population कि भाई बाकी को हो सकता है हमको तो नहीं हो सकता. But because of this, I think this hinders a bit of going for regular checkups or for early detection. So can you discuss the common myths and misconceptions about breast cancer, and that becomes a challenge or hinders the early detection?
So, as I have already told, ki early detection is for the patient's protection. But unfortunately, there are a lot of myths associated with the disease. कि हाय मेरे को हो गया अब मुझे क्या होगा या many a times a patient has been diagnosed but still the family members will try to say कि किसी को बताना नहीं है ये तो ऐसा है कि जैसे कोई टैबू है कि पता नहीं छुआछूत की बीमारी है कि सबको हो जाएगी so they try to hide the things so this leads on to a delay a lag in the starting of the treatment so this is the most important myth कि ये कोई छुआछूत की बीमारी नहीं है ये किसी से होती नहीं है ऐसे कि it can be if early detection then it can be cured completely so this is the most important thing other hindrance is I will say the mammography aspect yearly mammography hardly any females get it done a screening mammography but I will advise strongly for a yearly mammography at least after 45 years of age and those patients who have a very strong family history or they have certain genetics positivity then they should undergo a screening mammography or even mr mammography is recommended for such kind of patients.
Thank you so much, Dr. Sameer, for explaining us all those things, because I think these are the actual root causes which needs to be answered or targeted. So thanks a lot for clearing us on that. Moving on to Dr. Praveena Vonna. Ma'am, if you can answer, what role do genetic factors play in increasing the risk of breast cancer? And how can genetic testing help in prevention of all such cancers? Because of all these medical advancements nowadays we have, I think it is possible to get this detected early.
Yes, actually, most of the breast cancers we call as sporadic. 90% of breast cancers happen without any family history or without any genetic factors. Only around 10% of breast cancers are related to genetic factors. Out of these genetic factors, already Sir has mentioned about BRCA1 and BRCA2 mutations. These are the most common causes. So we generally advise this testing based on their family history. Suppose if significant family history of more than 2 or 3 members having breast cancers at younger age, getting at younger age, or multiple persons in the family having ovarian cancers or male breast cancers, like that some criteria will be there. Patient whom persons who meet that criteria, for such persons we advise genetic testing. Actually it is a simple blood test. Now it is widely available in many laboratories. So if in the genetic testing, if we identify any such factors, then based on that mutation, we advise some risk reduction strategies. So if they follow these risk reduction strategies, whereby we can prevent such cancers. For example, for patients having BRCA1 and BRCA2 mutations, we advise removal of both breasts and both tubes and ovaries after completion of childbearing, so that we can very much prevent the development of breast cancer and ovarian cancer. Like that, at early age, Sar has already mentioned about screening strategies, mammogram and MRA. From early age, we can advise them screening strategies for early detection also. So, based on this, this collection strategies and screening test, we can the genetic factors will help us.
Also, ma'am, a follow-up question on that, because I got some example on this, that as early the cancer is diagnosed in a person or a lady, it is more likely to be genetically, because now we say the age is from 40 or above 40 ladies, but what if the cancer is detected at an early stage, 25, 30, 35? So is it possible that it is more likely to be genetically transferred?
Yes, yes. If any person gets breast cancer at younger age, then the chance will be high that she is having some genetic factor behind that. Such patients, we generally recommend genetic testing. It not only helps in the counseling other family members, but also it has treatment implications now. Based on the genetic mutations, a lot of targeted therapy drugs have come into picture. For persons having those mutations, we will advise those medications. So definitely, any person gets breast cancer at young age, there are high chance of having genetic factors behind that. For such patients, genetic testing is recommended.
Thank you, ma'am, for clearing that out. Moving forward with Dr. Mohit. So, can we explain us what are some early signs, symptoms of breast cancer that women and men should be aware of? Because according to World Health Organization, men's are also at 1% risk of having this breast cancer. That's why I added men and women.
So that's a very beautiful point you bring out here. Of course, it is more common in female, but male are not immune for breast cancer. You should know about this. So both men should and women should know about what are the warning sign or symptoms of breast cancer. So to begin with, of course, if there is swelling or lump in breast or chest wall of man, then it might be. Or you will not only you should check about breast, but there any swelling or lump in the armpit, then that can also be a sign of breast cancer. So it's not about only breast or chest wall. Of course, you should know about you should be familiar about the size, shape, because if they are color, texture, because if there is change in color, then might be some redness or something. So that might be a sign of breast cancer. If there is changes texture, or there is changes size, or there is changes shape of the chest wall or breast, then these might be the sign of cancer. There might be some puckering of dimpling you can notice. If you are noticing them, then of course there might be sign of breast cancer. There is any nipple retraction, or you can say nipple discharge, or you can find there is some asymmetry between the both part of the body, then that might be a sign of breast cancer. And in case, of course, there might be pain might be associated. That might also be the initial symptom. So the idea is that if you have any of these symptoms, so you are not supposed to ignore them, and you should talk to the doctor. That's the idea. I have just prepared one liner kind of thing. ब्रेस्ट या आर्मपिट में हो गांठ या सूजन, कलर टेक्सचर साइज शेप में परिवर्तन, पकरिंग डिपलिंग, निपल डिस्चार्ज और निपल रिट्रैक्शन, ये है ब्रेस्ट कैंसर के लक्षण.
सर आई थिंक इससे ज़्यादा सिंपल तरीके से और कोई नहीं बता सकता, because this is the best way to educate and aware public, and these are the kind of symptoms which should not be go unnoticed, because if it is there, then people should definitely and as early as possible should come and consult their doctors and get all their testing done, because as soon as this get detected, the treatment plans get started, right? So with this message which Dr. Samir gave us, moving on Dr. Mohit gave us, moving on to Dr. Samir. So, like sir gave us an, जो एक सर ने एक मंत्र बोला या कुछ लाइनें बोली कि वो एग्जैक्टली क्या है फॉर दिस अर्ली डिटेक्शन. So, as this was an educational message, so how can we improve public awareness and encourage more women to participate in regular breast cancer screenings?
So, as we have already discussed the importance of screening. So, one thing is very clear: screening is the mantra for early detection and cure of the patient. So, how can we increase the awareness? We can have various camps. It's basically a targeted approach is required, which requires an information, education, and motivation of these individuals. And how can we do these things? We can do these things by a community approach. Like community approach is like organizing community health fairs or having a breast cancer awareness walks, marathons, pinkathlons. We are organizing regularly events like this, or collaborate with local organizers like schools, workplaces, or religious institutes and give them the message of screening and other program. Other is the educational campaigns. We are doing, just like now we are doing the social media campaigns, the digital platform, Instagram, Facebook, all these things, using various influencers, partnering with the influencers. These are also very important in dispersing this information. And there are other like public service announcements which regularly should be given to encourage all the females for the screening mammography and screening program on radio, television, and etc. And another is mobile apps where the females can check regularly, and telemedicines and lot of things. And low access areas are also there where this screening, the concept of screening is not at all there. So we have to reach those areas also. And these are few of the things which we can do to encourage our females for early screening and early detection.
I think, sir, you said it right. As more and more screenings are there, as more and more we educate them towards the disease, that how deadly it could be if not diagnosed on time, and what are the ways on which we can educate them. These are the ways how we can do this. And another way is through this kind of forums, platform, and with the help of all the doctors, panelists which come for all these kind of sessions. Like you have somehow taken time out of your busy schedule and come here for educating and awareing public about this is one of a very good medium where experts are here talking to the public, directly connecting with them. So thank you so much thank you so much all for this again. Moving on to my next question with Dr. Kumardeep Datta Choudhary. He has joined with us. Thank you so much, sir, for joining in for this session, and welcome to our show. I would like to start with my question that what lifestyle factors are most closely linked with to an increased risk of breast cancer, especially amongst the rural and urban area, the difference in that. Dr. Kumar, am I audible to you? Dr. Kumar,
I think
some signal issues there. Yes, sir, I believe so. Uh, Dr. Kumar, can you hear me?
I don't think he's-
Yeah. So I would request Dr. Praveena, ma'am, can you please answer this question that what lifestyle factors are most closely linked to an increased risk of breast cancer in rural and urban areas both?
Actually, urbanization is the most important thing. For example, now many women are working women doing jobs, getting marriages late childbirth, not breastfeeding properly. So these are the main reasons. So for example, if you compare any woman who is having a child prior to the age of 25 years, for such women the risk of getting breast cancer is very less compared to women who give first childbirth after the age of 30 or 35. So and also physical inactivity, lack of proper exercise, sedentary lifestyle leading to obesity. These are the main lifestyle factors, and so we should uh, raise awareness among the public regarding these risk factors, and they should be am I audible?
Yes, ma'am. Yes,
Yeah,
ma'am. You're
we should.
audible. Please continue.
We should raise awareness among the public regarding these risk factors. And as already sir said, the schools, colleges, so women's should be trained from should be counseled from very young age regarding these lifestyle factors. So regarding importance of physical activity, balanced diet, maintaining healthy ideal body weight, body mass index, and alcohol should be avoided. And first childbirth should be at a appropriate age. And breastfeeding also very much protective against breast cancer. All women should be encouraged to breastfeed their children for at least 1.5 to 2 years.
Thank you, ma'am, for
So
answering. Yeah, yes, ma'am.
yeah, these are the main lifestyle factors related to breast cancer. These are all modifiable factors. Remaining unmodifiable factors like what we have discussed, genetic factors, any exposure to radiation at young age, age at menarche and menopause, these are all also risk factors of breast cancer, but they are not non-modifiable. We cannot modify those. So we should concentrate on this modifiable risk factor. We should raise awareness among the public regarding these risk factors. Thereby, we can prevent development of breast cancer.
Ma'am, when we talk about the radiation at an early stage, in terms of, or according to the layman's term, layman's language, what exactly is the all those kind of radiation? Is it all those x-rays if we go to hospital, or the MRIs which we get done, or any specific kind of therapies
Not that
we have?
radiation. Yeah.
Hmm.
Any person who receives radiation to their chest at young age for other diseases.
Okay.
So, after 10 years or 20 years, such persons will be at high risk for developing breast cancer.
Got it, got it. Because normally layman's connect radiation with all those kind of rays, but thank you so much for clearing that out. So I would just like to connect with Dr. Kumar. Sir, can you hear us?
Yes, yes, ma'am. I could hear you. Yeah.
Yes, sir. Thank you so much for joining in and welcome to our show. Earlier, we could not hear you because
Thank
of
you.
some weak signals, but that's fine. It's good you have joined here back. Sir, my first question would be to you: can breast cancer be prevented, and what steps can individual take to reduce the risk or the chances of getting breast cancer?
Repetition of the last question.
Sir,
Yeah. Can you repeat the question?
sure, sure. Can breast cancer be prevented? I am repeating, sir. Can breast cancer be prevented, and what steps can individual take to reduce the risk of getting this breast cancer?
Breast cancer is there is, as we have discussed earlier, the other esteemed guest has discussed earlier, that there are some modifiable factors and there are some unmodifiable factors for that, like unmodifiable factors like genetic factors or age of menarche or the age of menopause. If the period of exposure of the estrogen level is increasing, these are not modifiable. But uh, as of now, we can decrease the chances of getting breast cancer, but we cannot exactly eliminate the chances of getting breast cancer, because being female is a risk factor. Though it does not mean that the male cannot get breast cancer. One out of 100 male female breast cancer, there will be one male breast cancer also. And as the being female is in US, they say one out of 8 female had a chance of developing breast cancer. And as the age increases, the chance of developing breast cancer also increases. Like for someone who is less than 30 years of age, the chance of developing breast cancer is around 0.5%. But in 40 years, it is 1.5%. In 50 years, it is 2.5%. In uh, 60 years, it is 3.55%. And 70 years, it is 4% or beyond that. So as the age increases, the chances of getting breast cancer is increasing. But with your healthy lifestyle, healthy diet habit, avoiding alcohol, doing regular exercises, cycling or exercises, not following a sedentary lifestyle, so you are trying to avoid those things. You are trying to reduce the risk of the breast cancer. Being obese is a breast cancer risk, increases the breast cancer risk. If you are taking oral contraceptive pills for long, chances of developing breast cancer increases. Or someone after menopause, if someone is being exposed to hormonal manipulations like hormone replacement therapy for long, then again the chance of developing breast cancer increases. So if you are avoiding all these at-risk behaviors, the chances will be less, but it will not be zero. So basically that is the lifestyle factors. And then for prevention factor, yes, after 40 years, annual mammogram is one of the way to detect early breast cancer. Self breast examination and clinical breast examination, these are the three prong attack on which you can do the screening program and detect breast cancer at the early stages. And the benefits of the early stage is that because at the early stage it is curable, chances of recovery is almost 100%, and you can avoid radiation, we can avoid chemotherapy if it is detected in the stage 1 disease. So prevent, I mean, like uh, screening programs can help you detect the cancer in the early stages, but does not mean that it can prevent. You are doing annual mammography, it does not prevent that you will not have breast cancer. Yes, you can have breast cancer, but the advantage is that it will be detected very early stage, where you can be cured with only surgery, with the less intensive treatment, less duration of treatment. Your money will be saved, your body will be saved from the ill effects of the systemic therapy. That's all.
Thank you so much, Dr. Kumar, for explaining us on that and clearing and awareing our audience much more on this. Moving to Dr. Mohit. So, like we all are talking about the factors which can be modified or modifiable or non-modifiable factors which can cause more chances of having breast cancer. There's a role of diet and physical activities which impact a lot on breast cancer. So how does diet and physical activity play a major role in impacting breast cancer risk, and what specific recommendation would you give to everyone, every listener?
So there is, of course, we should always focus on modifiable risk factors because that's the area where we can do and make the changes. So if you talk about the diet, then of course, if we talk about the healthy diet, then the diet which is rich in fruits like berries or with the green leafy vegetables. So that is supposed to this classically told as healthy diet. And healthy diets are having a lot of benefits. One of them is cancer prevention, and of course, we are talking about breast cancer. So, of course, if you are taking the healthy diet, like diet rich in fruits and vegetables, then of course there will be chances of the breast cancer will be reduced. Now, there is some controversy regarding the use of fat intake in the diet, but of course, the diet which is rich in fat causes many harm. Indirectly, it causes obesity, and obesity is directly linked to, of course, breast cancer. So, of course, a diet which is rich in fat that should be avoided from the breast cancer point of view. Now, if we look about the physical activity, then it is also, of course, the sedentary lifestyle is definitely a risk factor for breast cancer. If a lady or person is fully active, then I think the chances of breast cancers are reduced by 12 to 20%. So it makes a huge impact. It's not, there are small things which we can do. Now, we should maintain healthy weight, irrespective of we are talking about male or female. The healthy weight should be maintained. Reason being, because if the body mass index is more than 31, means of course we are talking about the obesity, especially in the post-menopausal ladies, then the chances of breast cancer are 2.5 times higher than the body mass index is less than 21. So, of course, especially in the post-menopausal lady, if the body mass index is higher, then of course the chances of breast cancer will be more. So try to maintain the healthy weight, try to maintain the regular exercises. We should be active, whatever you like cycling, you like swimming, whatever you can do, or even just walking simple, that's also effective. And of course, we are talking about the lifestyle, and of course, say no to tobacco. The smoking is injurious for many reasons, and of course, cancer is one of them. Of course, alcohol should be avoided. So these are the things which we can do. So if you are talking about the recommendation, then of course the recommendations are similar. Maintain a healthy weight, be physically active, avoid alcohol, avoid smoking, and of course, as we are talking about, then if possible, avoid the oral contraceptive pills and hormone replacement therapy after menopause. Breastfeeding should be encouraged. These are the things which we can do. And of course, screening is important, as discussed by our seniors.
Thank you so much, Dr. Mohit, for answering that question to us and emphasizing on the role of diet and physical activity. Yes, it is one of a very important factor which plays a biggest role in avoiding any kind of disease, be it breast cancer or any other form of cancer, because कहते हैं ना कि आपका मन अच्छा है तो आपका शरीर अच्छा है, तो शायद फिजिकल एक्टिविटी करके हमें एक संतुष्टि मिलती है, some hormones got released with sweat and every other thing, so it keeps us refreshing, and healthy food keeps us happy and healthy. So I think everything is linked towards our health and body. So thank you for that. Moving on to my next question from Dr. Sameer. So are there any environmental or workplace factors also that increases the risk of breast cancer, and how can we mitigate them? Because we just talked about food and healthy lifestyle from Dr. Mohit, and it becomes very difficult nowadays to balance it with our work life balance. there's lot of pressure, commitment. People are more ambitious now, so they want to work and work, and in between they forget their life, the food, the physical activity, and every other thing. So how can this affect?
So, Simiran, this is definitely the case. The sedentary jobs or pressure is so much. We are sitting in front of our computers or somewhere and hardly doing any activity. And leading on this sedentary lifestyle, leading on to obesity, the hormonal imbalances, high fat diets. Often we are Swiggy, Zomato, pizza, etc. So often we are doing it in our day-to-day life and leading on to high fat diet, high carbohydrate diet, unhealthy eating. All these factors in the workplace also leading on to increased risk. Other often forgotten risk factors like chemical exposures, increase in chemical exposure. There was a mention about radiation exposure also. So these are also very important aspect. Chemical, as far as pesticides, we are using pesticide, chemicals like benzene or solvents. These are again increases the risk of breast cancer and other cancers also. And regarding this radiation exposure, like medical radiations like X-rays and CT scans, often our healthcare workers are exposed to these radiation exposures. And other is the even the nuclear power plants are there. There the workers are there. They are also exposed. So females, Kaskar, they are exposed. Uh, our radiation oncologist friends, they often get the radiation, and even the CT scan, the females working there, they are advised for this thing. So this is important thing. And another thing is the electromagnetic fields, EMF. So increased exposure to EMF also can lead to not only breast and other cancers, also skin cancer and all. And these are the basically the environmental or workplace. Another thing is the hot topic of Delhi these days, the air pollution, this PM 2.5, and the polyaromatic hydrocarbons, PAH as it is called. So again, a long term exposure can lead on to again many cancers, and breast cancer is one of them. So how to mitigate? We have talked about the mitigation part, like sedentary lifestyle. We have to be active in our lifestyle wherever possible. Do yoga, do this. Have a balanced diet, healthy lifestyle, regular exercises, and important, most important is I think no smoking and no alcohol. Though it becomes very difficult, and at least small amount maybe, but not too much indulgence in alcohol. This is the mantra of prevention of then mitigation of these factors.
You pointed out right. So smoking and consumption of alcohol is has is one of the biggest reason which has added to more of such kind of diseases, the lifestyle diseases which were not earlier much prevalent, but now has every nowadays has become very or I should say popular, because all these terms are very frequently we're hearing this. And I think all the credit goes to the smoking and alcohol consumption. Now, because of the peer group, people, even if they do not consume it, they are taking it, right? So this is a very bad example is setting up in the society. And everything, I believe, like Dr. Samir said, uh, if it is in limit, it can be consumed, especially alcohol. But I don't think any doctor promotes smoking. Like you strictly said no to smoking as well. But yes, moving on to my next question from Dr. Kumar. Dr. Kumar, like Dr. You also mentioned, and Dr. Mohit also mentioned in his answer about HRT, that is the hormone replacement therapy. So, what exactly this is, and can you explain the link between HRT and the risk of breast cancer?
So basically, after menopause, ladies face various kinds of symptoms postmenopausal. We call it collectively postmenopausal symptoms. There may be wild mood swing. There may be many problems like loss of bone mineral density, osteoporosis, weakness, fatigue, and the spikes and of mood and all these things. So to mitigate that, when they meet their gynecologist, they prescribe some estrogen tablets for them. So these estrogen tablets, again, they mimic because during the menstruation period, they are exposed to estrogen. During the productive life of the ladies, they are exposed to, from menarche to menopause, they're exposed to high level of estrogen. So so they try to postmenopausal, they try to create an artificial environment of like that. So so these symptoms are being mitigated because all these are related to the hormones. Our mood swings and all these are, most of the things are related to our hormone secretion. So uh, when they give this hormone replacement therapy for a longer time, because as we know, the breast cancer is related to the estrogen hormones and all. So they stimulate these hormones, unregulated estrogen exposure, stimulate the cancer cell in our breast tissues and ovaries. So longer exposure of these drugs can lead to breast cancer.
Thank you so much, sir, for
Even
explaining us. Yes, sir.
and there are
Please continue.
certain even uh, those who are taking the oral contraceptive pill for the long durations, they may also somehow may contribute for though it is a small percentage, but there may be a high risk of breast cancer.
Thanks a lot, sir, for awareing us on that and actually pointing us all those things which may add on to the risk of breast cancer, and that too that needs to be avoided. So thanks a lot. Moving on to our next segment, that is treatment options and innovations, starting with Dr. Praveena. Ma'am, what are the latest advancements in breast cancer treatment and how are they improving the patient outcomes nowadays because of all those research innovations which are being done and the clinical trials that has helped us to reach to a stage where we have so much of better option as compared to the earlier times.
Yes. First of all, we should know that all breast cancers are not same. Treatment for all breast cancers is not same. So we decide breast cancer treatment based on their receptor status, hormone receptor and HER2 receptor. Previous years, we used to give mostly chemotherapies and hormone therapies. But in recent years, many latest drugs like targeted therapy drugs and immunotherapy drugs have come into picture. We are now escalating and de-escalating treatments. Suppose for high risk patients, we are escalating the treatment to reduce the risk of recurrence. For low risk patients, we decide based on some molecular assays and prognostic markers. We are latest tests we are doing now. Based on those, for low risk patients, we are trying to reduce the treatment burden. We are avoiding chemotherapy for many patients after surgery. So these are, and also immunotherapy. This is the immunotherapy is the latest buzz in medical oncology. So immunotherapy drugs also we are giving now widely. So with these latest techniques, we are very much improving the cure rates and survival rates of these patients. And this is regarding systemic therapy and regarding radiation also. Suppose our radiation oncologist friends are giving now for left-sided breast cancers, they are giving treatment through some latest techniques like DABH, breath holding techniques, so that they are trying to reduce the exposure of heart to radiation. So they are reducing the side effects of radiation. So like this, many late and coming to surgeries, reconstructive surgeries. Many surgical oncologists are now doing reconstructive surgery after mastectomy. So these are the latest advances. With these latest techniques, we are very much improving the lifespan of these patients. So not only for localized diseases, for stage 4 disease also. Generally, what we say for cancer patients, stage 4 disease, it is not curable. Lifespan will be very less. But even stage 4 breast cancer patients, for some subsets like hormone receptor positive subsets, we are now with latest drugs, we are now able to prolong their lifespan up to 4 to 5 years also. So these are the latest advancements.
Thank you so much, ma'am, for putting that spotlight on the recent latest advancements for treating breast cancer. moving on to Dr. Mohit. So, Dr. Praveena also mentioned about the immunotherapy. So, could you explain us how has immunotherapy changed the landscape of breast cancer treatment, and who are the ideal candidates for this approach?
So just to begin with, I am just explaining the terms that we are using. Of course, in the treatment, there are two type of treatment. One is local treatment. Among this, there are two things, either surgery or radiation. And we are talking about the systemic therapy. What is systemic therapy? Which acts at all the wherever the cancer cell is, whether visible or not. That is called systemic therapy. So among the systemic therapy, we are talking about chemotherapy. We are talking about the hormone therapy, we are talking about the target therapy, and of course, the latest buzz, as shown by ma'am, is immunotherapy. Now, there is a lot of hype for the immunotherapy. Reason being simple because it acts by boosting our own immune system to fight against cancer. So it's not something which we are just empowering our immune system for the fighting against cancer. So that's why there is a lot of hype about the immunotherapy. But we should know that immunotherapy is not for all patients. It's not like that all breast cancer patients are candidate for immunotherapy. Ma'am told about the three classifications that, of course, we say the receptor status, that is ER, PR, and HER2. So, of course, we, in general, from a treatment point of view, we classify them either hormone positive or HER2 positive, and the third variety is triple negative. That's all three are negative. ER, PR, HER2 all are negative. These are the basically we do put the test and we get the report, and if all three are negative, then the patient is triple negative. Now, these are the patients who actually get benefit from the immunotherapy, and in two ways. Whether if they are early stage, like stage 2 or 3, then we use it in a neoadjuvant manner. What is neoadjuvant? Means before surgery we give some treatment. What treatment? Of course, chemotherapy. But if we add immunotherapy to the chemotherapy in triple negative stage 2 or 3 cancer patient, then we achieve good result. What good result? We can achieve the pathological complete response, and is increased by 12 to 30, 15%. Means what is pathological complete response? Then when the surgeon gets it operated, then pathologist find nothing. It's all clear with the treatment given prior to surgery. So that's the beauty. If we know in the triple negative that if we achieve the pathological complete response, then outcome are better. So the idea of adding immunotherapy in these patients is to increase the chances of pathological complete response and to reduce the chances of recurrence. The chances are reduced by almost, I think, 35% or so if we add immunotherapy to of course, the classical treatment of chemotherapy, and of course, immunotherapy to get it before surgery as well as after surgery in these kind of patients. Now, moving to the another use of immunotherapy in this triple negative patient is for stage 4 patients. So, of course, we know that we can't cure them, but we use our treatment like judicially, and we can prolong their life and reduce the suffering to a lot of it. So, in stage 4 cancer patient, breast cancer patient, we do a test called PDL1. And if the PDL1 is more than 10%, then of course, if we add immunotherapy, the results are better. See, the chances of dying are reduced by 25%. So that is we call it hazard ratio or something. So that's the idea. That's the beauty of immunotherapy, that it increases, reduces the chances of recurrence, it prolongs survival, and of course, it doesn't add to side effects. There are side effects. Of course, there are some side effects of immunotherapy, but these are quite well manageable. There's not a big deal. So that's the beauty of immunotherapy.
Thank you, sir, for explaining us everything about immunotherapy and how it works and its benefits as well. Because as we're moving on, talking on the treatment options which is available, it is the most important part in today's time to spread awareness about the treatment options of any disease which is available in the market, because people get afraid. Okay, I have got diagnosed with this, maybe there's no chances of surviving or anything. But the most important part is, because of the medical advancements, research developments, everything is possible. And we in every session we say this: cancer is not a deadly disease if diagnosed early, treatment started early. So I think every person, because of all the good doctors, experienced doctors, research, medical advancements, everything is possible nowadays. And since we're talking about the medical advancements and the new developments, there's one more new term which is, very famous or popular in the medical industry, that is the personalized medicine. So, to Dr. Sameer, sir, what role does personalized medicine play in breast cancer treatment, and how does it differ from the traditional methods?
So, Simran, the previous speakers have already told about the advancements, how the treatment has evolved, and now we are talking on precision. So, all these things is a personalized treatment. But traditionally, what we were doing, or what years together, 100 years, or maybe 150 years back, one size fits all. This was the approach. And
Yeah.
now we know it is not there. One size mean in 1890, I think, first time the surgery for breast cancer was done. That was the Hellstead operation. Massive removal of this breast was there, leading on to lot of complication. We have moved a lot from that era. And now we are talking about the personalized medicine. What it is personalized, basically we are now tailoring the treatment based on the genetic makeup of the patient, the specific targets. We were talking about HER2 new target, ER, PR, PDL1, lot of talk was there of PDL1. So these are the specific targets are there. They have specific characteristics associated with them. So now we can target these treatment accordingly, the targeted therapies we are there. So importantly, these personalized medicines or targeted therapies, immunotherapies, they are more precise, they are more effective, they have less toxicity. And of course, when this have a less toxicity, more effective, so it leads on to the better quality of life. We were talking about the myths of breast cancer, how the patient feels, the feeling of fear is there कि toxicity हो जाएगी treatment के साथ में. तो now we can confidently tell the female कि toxicity इतनी ज़्यादा नहीं होगी, अब हम आपके target को ही target करेंगे.
Yeah.
So better responses are there, better survival is there. So personalized medicines, like we are talking about trastuzumab, immunotherapy, and important is now the genetic testing also is there. We are
Yeah.
total exome. We are detecting that this is called NGS, and comprehensive genomic profiling is also there. Like, and one test is there which is called Oncotype DX. वो ER/PR positive females है, early breast cancer है, so we get it done, and when then we can tell कि whether chemotherapy has to be given or not, depending on the recurrence score which we get. So this is also personalized for that patient, so we can avoid the toxicities of chemotherapy for such kind of patient by just doing a test. The results come and it clearly tells the recurrence score. If it is high, we give chemotherapy. It is low, we don't give chemotherapy. So we have come a long way from one size fits all to a personalized, better, precise treatment. So this is the personalized medicine which we are talking about now.
Thanks a lot, Dr. Sameer, for putting that in a very clear language so that everyone can understand. Moving on to Dr. Kumar. So we know how tirelessly doctors are working to to treat all their patients equally, putting their time, energy, efforts, and everything they can. But the thing is, how can patients and healthcare providers better together collaborate to choose the most suitable treatment plan?
Uh, like as they have my previous speakers have stressed on the different types of the breast cancer and how we can take best out of the world. Like for triple negative breast cancer, those who are immunotherapy markers positive, we can treat them with the immunotherapy. Those who are all negative, like all marker negative, even PDL1 marker negative, they can be treated with the chemotherapy. Those who are HER2 positive, they can be treated with the targeted therapy. Those who are ER/PR positive or hormone receptor positive, they can be treated. Even in the stage 4 disease, we can avoid chemotherapy and we can treat them with the hormone therapy and oral therapy. So the minimum number of hospital visit can be done. So this is to me this is personalized medicine. Every patient is not same. Every patient, though they are suffering from the breast cancer, but had a different biology, different disease, different treatment, different drug, and so the collaboration must be between the physician, the science, and the scientist also must collaborate. We should encourage our scientists to do more research and come up with the newer drugs and generic version of the drug, because the immunotherapy today, the hindrance for the immunotherapy is that penetration is not very high. Most of the patients who are taking immunotherapy, either they are rich, they are out paying out of pocket, or they are from the panel patient. Ordinary middle class populations, they can't afford immunotherapy because the cost is very high. So my appeal to the Indian government and the Indian scientific fora will be that they should work on these drugs. They should come up with the generic version of the immunotherapy drugs so that the cost of the therapy will be less and they can be afforded by the patients, by the mass, so that we can take the benefit of the scientific research, benefit of the result of technology to all the people in this country, and we can give the maximum benefit of the recent advances in the treatment of breast cancer to all, because there are certain drugs called pertuzumab or trastuzumab. The generic version of these drugs are now available, and initially when the generic versions were not available for these drugs, only 10 or 15% of the patients could afford these drugs. Now, with the availability of the generic versions of the drugs, almost 90% of the eligible patient could afford these drugs. So, same thing should happen also with the immunotherapy drugs, because they are the game changer in the today's world. So, this is my appeal to the government and the corporate sectors and the scientific forums that should come up with the answer for the immunotherapy, so that the advantage of the immunotherapy drugs and the new drugs can be given to our patient.
Thank you, Dr. Kumar, for explaining us on that. Now we are moving on to our next segment, that is post-treatment care and survivorship, and these will be our last question for the today's panel discussion. Starting with Dr. Praveena, ma'am, what are the main challenges breast cancer survivors face after treatment, and how can they navigate their life post recovery?
Yeah. Am I audible?
Yes, ma'am, you're audible.
So, not only physical stress, emotionally also they will be very weak, because they came through lot of treatment, surgery, radiations, chemotherapies, lot of systemic therapies. They already exposed to lot of side effects, so that anxiety and depression will be there. So there should be healthy environment in the family and also at the workplace also, to help them cope up with this struggle, and they should help them to come out of this. And also, regarding the survivorship, all treated patients should be under regular follow-up with the primary treating doctor at regular intervals. For example, first 3 years they should come for follow-up every 3 monthly. After that, they can come for follow-up for 4 to 6 months gap. After 5 years, yearly. During this follow-up, the doctor discuss with them regarding the any signs and symptoms of recurrence, and also they will advise them to do the test if necessary. And also after treatment also, yearly once annual mammogram is recommended for the opposite breast. So like this, they should discuss with doctor in detail. And also if they feel any depression, or doctor should counsel and should identify if there are any signs of depression or anxiety, and should counsel them accordingly. So for many patients feel that after completion of treatment, my treatment is over. There is no need for follow up, but that is not the case. They should be under regular follow up with the doctor, not only to detect early recurrence and also to identify late side effects of these cancer treatments.
Thanks a lot, ma'am, for summing that up for us. Moving on to Dr. Mohit. So, how important is the post-treatment monitoring? Because we have seen a lot of cases where cancer has relapsed, and if not taken proper care, the guidance which doctor has told, and the treatment or the medication or any other recommendations given by the doctor, So, how important is the post-treatment monitoring, and what should breast cancer survivors look out for to prevent this reoccurrence of cancer?
So as ma'am already point out that of course once the treatment is complete, then of course lady should follow the surveillance protocol. We call it surveillance because it's not the passive thing that once patient will have some trouble, then he will come. We call it surveillance because patient is supposed to come and discuss about about the things, even if he or she is asymptomatic. So in the first 3 years, we call the patient every 3 months. And for what we do the take the history, we take the physical examination, and of course we do the once in a year the mammography should be done if the patient is on tablet like tamoxifen, and of course pelvic examination is a part of the treatment for to detect some uh, endometrial hyperplasia. So initial 3 years it is almost 2 to 3 years it is 6 monthly. Then for the next 2 years it is 4 to 6 monthly, and after 5 years once in a year. So the annual mammogram is a must. It should be done irrespective of the symptom. Rest depend upon the patient's symptoms. Say if patient is telling about the chest related symptoms, then we can offer the chest X-ray or maybe CT scan. If patient is telling about the bone related symptoms, say back ache, then we might think about offering the MRI. So these are the idea to diagnose the recurrence at the early point when it is treatable. So these are the things which we do. Say if patient is telling about the pain in tummy, then we can also think about offering some ultrasound or CT scan. So rest of investigation are based on the patient's condition and the finding on the clinical examination. That's how we monitor the patient. Now the another part what we ma'am rightly told about the late treatment related side effects. And of course the cardiac side effects are must, and so we again and again tell them to of course follow the healthy lifestyle. We reinforce to them to maintain healthy weight. Of course we check the lipid profile, and so maybe to that whether the cardiac markers are okay or not. And regarding the other side effect as well, so of course we are supposed to think about not only about the disease but about the treatment related effects as well. And of course we are supposed to address the other problem of the patient as well. Many of the time we can't handle because we are doctors, so we can just think about addressing the physical and of course maybe some emotional problem we can address. But there are other problems as well, like some social issues might be there, uh, some occupation issues might be there, some insurance issues might be there. Say patient is having been treated with the cancer earlier, then I don't know whether they will get the insurance or not, and if they are getting insurance, then at what premium. So they might have some trouble in the job that this patient is survivor. So other people should also understand that they are trying to go back to their life. So other people should also help them to go back to their life. Society should accept them. That in the job profile they should know that of course there is always a chances of recurrence, but of course they should get the proper job opportunity. The insurance people might understand that. So it's a collective role. It's not about between just doctor and patient. It's I think it's a role of the whole society to take care of these patients.
Yes, I think you pointed out right. It's role of the society to take care of this. Even after the post treatment, there's some emotional damage, and there's this little bit of drainage, personality loss, confidence loss. There's this hesitancy facing the society and people meeting every day. So I think post treatment, during the treatment, doctors has played a major role and done a commendable job while treating their patient and making out of them of this deadly disease called cancer. And even after that, psychologists help us to recover from this. But society has to play a major role in accepting and encouraging. Okay, whatever has happened. It has gone now. Move on. Take new steps. Life is there. You have to do so much of other beautiful things. So thank you so much for pointing out that. Moving on to my last question, Dr. Sameer. Sir, can you please sum up this session with what is being done to promote the awareness and inclusion of male breast cancer, and how can men support fight against this breast cancer, also not only the females?
So, a very important thing to remember is कि ये सिर्फ फीमेल्स की बीमारी नहीं है, तो मेल्स कैन ऑल्सो हैव, बट अनफॉर्चुनेटली ऑफन यही होता है कि मेल्स टेंड टू से कि अरे मुझे थोड़ी हो सकता है ये, कि मेरी बीमारी थोड़ी है. सो दे कम इन अ लेट स्टेज ऑफ the diagnosis. Often they have ulcerations, or we call it T4 lesion, T3 lesion at least, and they have a very aggressive disease as per se, as compared to the other breast. Though the treatment aspects are more or less the same, but again, okay, so generally they have a family history also. BRCA may be positive or not, but important is they should know it can happen to them also. And if there is a symptom pertaining to a breast cancer, there is a lump is there in the breast, or itching is there, or something odd is going on, so they should consult, and there is no taboo about that. And they should consult the doctor as soon as possible, because again, as we have been discussing for the last 1 hour or so, okay, if it is detected early, it is curable. But unfortunately, as fat tissue is not there that much in the males, so diagnosis becomes a little delayed, and it may be stage 3 or 4 when the patient finally arrives, and maybe the patient is not curable.
Thank you so much, Dr. Sameer, for summing up this session and leaving us with this important and impactful message. Because, yes, it is not just a female's disease, it is caused to male also. It's just that it is not yet accepted in society, okay, that men can also have breast cancer. They have to be equally cautious about their health. They also have to take equal, you know, those steps in which they can avoid the risk of having breast cancer or any other type of cancer, because all the lives are equally important. So I would like to thank each panelist present here over part of this impactful, great panel discussion, for becoming this strong voice and spreading the awareness of breast cancer to all our listeners, audience, everyone out there. Thank you so much to all the doctors for sharing their insights and expertise with us, coming on this platform, taking out time out of a busy schedule, because it means a lot. So, thank you so much, everyone.
Thank you. Thank you very much. Bye-bye.
Thank you.
Thank you.
Thank you.